I just got out of the shower. So that's why I have a towel wrapped around my head, because I'm laying down on my bed. I am exhausted. It's like 5 o'clock at night, and I worked today. I worked my Chinese job in the morning, where I teach English online. Then I taught, because I'm in the middle of the freaking pandemic, just like the rest of the world right now. But if this video makes it onto YouTube, I should say, let me turn it this way. If this video actually makes it onto YouTube, and say like you're watching this like in the future, I'm in the middle of the pandemic, so we're e-learning. I'm all like bundled up right now. I know this is a real sexy look. We're in the middle of a pandemic, and so we're e-learning in my state of Illinois. And I teach bilingual 7th and 8th grade. So I did that today. And you guys, I just want to come on real quick and kind of just say my piece, because I'm not doing okay. Not doing okay at all. I think it's very much IVF related. And earlier this week, this past weekend, so it's Thursday, So earlier this past weekend, I reached out to my IVF clinic because I didn't always have 20/20 vision, but for like a little bit more than a decade, 10 years, I've had 20/20 vision. And all of a sudden, my vision has gotten awful. Just awful. So I made an appointment with the eye doctor, who I've seen less than a year ago, mind you. And at first I'm thinking, oh, maybe it's because I'm doing all this e-learning, and maybe my eyes are just tired. Maybe it's from looking at my phone. But then I thought about it, and I'm like, ever since I started IVF, I've been noticing my eyes have just, it seems like things are getting harder and harder to see. And I did 2 back-to-back cycles of IVF, and my vision is so bad that I'm concerned, So I reached out this past weekend to the IVF clinic and asked them if there was a correlation with all the hormones, especially since I did it back to back. We're in September. I had an IVF cycle in like August, like end of like July, and then I had another one in August. So they were like back to back. And I'm getting ready for a 3rd IVF cycle, which I don't even want to do it, but I have to, basically. And first of all, I just turned 29 not that long ago. So yes, vision tends to get worse as we get older. Sorry, I keep hitting the camera like this is, but my arms are tired. I worked out. So yes, vision tends to get worse as we age, right? See, hair's all wet. But it's pretty drastic, But I didn't say that to my doctor. I just messaged them on the portal, and I just simply said, I'm experiencing vision changes. Is this possible that it's like an IVF symptom, or, because I just did all these like hormones and everything. And I just went like a few weeks ago and I got my blood drawn, and I still was like high in levels. Okay. So I don't think it's that unreasonable to parallel, I guess, correlate the two, right? Well, I get a message back from them saying you have to go to the eye doctor and get medical clearance before you do your third round of IVF. And it's like, BIT, itch. I'm just asking if it's a possibility. It's like, it makes me so crazy. Like, okay, I'm sorry I even asked. I won't ever ask another GD question again. How about that? And if something is seriously wrong, well, now I'm not comfortable asking you anymore, because your guys' first solution is for me to get, like, medical clearance, right? And I know they're just doing their job. Like, the rational me says they're doing their job. They don't want to be liable if you go blind or something, or, blah, blah, blah. I get it. But a simple, it's unlikely. We don't really come across this, we haven't come across vision changes in IVF all too often. It's not completely out of the realm. I understand where you're coming from, because blah, blah, blah. But to be safe, please go and get your vision checked. But it's like very defensive, I feel. And so then it makes me defensive. But I have to say, I have been, like, super, super, super depressed. Like, I have never experienced depression like this before. I've experienced being sad and having sad feelings. But I am, like, at my breaking point. And I am seeing a psychiatrist and a social worker, or a counselor lady, whatever. I don't think it's helping. I don't recognize myself. Even looking at the screen, I don't know who I'm looking at. I know it's supposed to be me, but it don't look like me. Nothing about this person I recognize. It's like the strangest thing. I keep saying it's gotta be the hormones. It's gotta be the changes in my body. I overstimulated and I gained like 30 pounds the first time around, because I was so bloated and just so massive and so uncomfortable. It's taken like 2 months, but I finally I'm almost back to my normal weight. I know that can't be good. Like, that cannot be good for me. And I'm not trying to, like, I'm not trying to be hysterical, or I don't like being this way. This isn't me. But it's so hard when I look in the mirror and the face I'm looking at doesn't look like my face. I don't know who this person is. I legitimately, you guys, it's the weirdest thing. But I don't know who I'm looking at. It's making my heart race. I feel like I'm going a little crazy. Maybe, I don't know. The other thing I want to say, and then I'll probably just get off, is I'm getting more and more upset with my husband. I have never felt feelings toward him like I do now. This is just me being raw and authentic. I'm not trying to be fake here. And I don't want to blame him. But he doesn't get it. Not really. He thinks I'm just mad, and I'm not mad at him. He didn't It's not his fault, right? You know that we can't have a baby, but in a way medically it is his fault. And I wish I already feel like I fix problems, but I can always seem to rely on my husband to help me, you know? But this is something he can't fix. It relies all on me, and it relies on me to do the injections. It relies on me to overstimulate it. It relies on me tenfold. And I don't think I can handle this anymore. I don't. Infertility, when it's male factor, it's hard to find people to relate, because even when you search on the internet and you find male factor infertility, you find there's just not as many there's not as much information, especially because my husband was born without a vas deferens, so he has sperm. Just you have to have surgery in order to retrieve the sperm. And then here's the problem. Frozen sperm is not as good as fresh. His motility in the sperm sucks. It's been frozen. We have used at least 2 vials. We're going to be using a third. And let's get real here. They use the best sperm first, the best vial first. And as we go down, and the more rounds I do of this crap, the crappier the sperm. I don't know. I don't want to be a person that someone doesn't want to come home to. That's not my intention. It's not what I want. But this is getting hard. And I'm tired all the time. I'm sad. I'm heartbroken. And there's nothing I can do.